I'd like to welcome back Dr. Farahman of Brilliant Smile. Great to have you back, by the way.
Thank
you very much. Now, you have been practicing dentistry for what, 27, 28 years?
Yes, over 27 years, yes.
And the location you're at now, which is over behind Coco's and Snooty Fox area, since 2005.
Yes.
Yes, and you have been serving this community even longer than that because you were in another office near here, right?
Yes.
Great to have you here because, as I said, we've known her for many, many years. And I think one of the things that stands out about you is that how long you've served this community and really the needs of the folks that live here, because let's face it, as we all age a little bit more, our needs, our medical needs, our dental needs are often different, and sometimes people get a little more sensitive about things, and this is what you're really, well, brilliant at. So what is your approach to practicing dentistry with people who are a little older? What do you see that's a little bit different?
I'm practicing for over 20 years in this area, and most of the people from Laguna Woods, as you know, they are elderly patients, and we need extra patience. We need a lot of other considerations that we have to take here. Financial, time, convenience in the waiting room, transportation, and we kind of got used to that right now. So, and I have patients for over 20 years that are coming to me, and when I was pregnant with my child, now they're asking me where he is. He's at college, and that's very interesting, you know, so that they stayed with me and we kind of grew up together, and I really love it, you know. And so at that time they were like 70 years old. Now they're 90 years old, and they're just still walking. They're just coming with a little walker there. It's very cute, and we have a very friendly office to offer all the special needs that they have right now at this age. And you know, again, considering all the facts that might be different between the elderly generation and the younger generation.
Right, and as you mentioned, you know, you talk about the different financial needs, and you know, you have all kinds of people here with different kinds of Medicare insurance, or some still have standard insurance, or whatever it might be. But again, you've been with this community and serving them for so long, you know how to handle all of that. Yes,
we do accept all the Medicare and Dentical programs. There are some payment plans option. There are some ways so that they can be served, and we do practice that, and we are very proud of it.
And your office really covers everything, right?
Yes.
From basic cleanings all the way up to dental implants. And you mentioned something before we started here, PRP?
Yes,
Did I get that?
Yes.
Yeah, what is that?
Yes, platelet-rich plasma. And this is in addition to our office. I have all the equipments to do this extra procedure when I do surgical extractions or implant or sinus surgeries, sinus lift, and all this stuff. And what we do is we take patients' own blood and we separate the serum, and we take that part, which is the platelet-rich plasma, and at that time we can add this to any grafting or anything over the wound, so to make everything heal better and for greater prognosis and result. And it's really working. Patients, they have less swelling, they have less redness, less post-op infection or any problem later, and they really appreciate that. And this is included in our treatment, and there is no charge for that. It means any patient who requests that for any sinus surgery or implant surgery, we can include that and at no charge. And that works very well, and we have done it. And again, like you mentioned, the good thing about having all these procedures done under one roof means a lot to the elderly generation. Why? Because they don't want to be transferred from one office to the other office to do the lower part of the implant and then the top part of the implant. We do everything under one roof. And we are very proud of it.
Well, I think that's convenient at any age.
Yes.
So just the basic daily care of people taking care of their teeth. We talked about this last time you were on.
Yes.
You talked about how electric toothbrushes and things like that, while they may be good, you find that most times people don't swap out the head of it very often because one, sometimes they're hard to find or they're costly. So you actually said you prefer just the regular old kind of toothpaste, but certain ones, right?
I'm coming from the old school. Use your normal toothbrush, but change it every 2 months. That's the key. If you're buying an electric toothbrush and you're not changing it, you know, every 2.5 months, if you're not changing the head, you're not doing anything good to yourself.
Okay.
So it's good for the first 2.5 months, and that's it. So it's very important to change the head. And I noticed if I introduce electric toothbrush, that's why I'm not even selling any toothbrush, electric toothbrush in my office, because I don't believe in that. What I really emphasize to the patient is get a water pick. It's not replacing the flossing, but it's really good in addition to your oral hygiene at home.
Yeah, I remember they came out in like the 1970s years ago. I didn't know they were still around.
Yeah, and I provided very simple one at my office, and which I'm buying from a dental company, and people, they love it because there is no booklet to read about to put them together. They just put it together, and they just put my, you know, their mouthwash that I'm recommending, they put it in the tank and ready to use. And it's really working. Yeah. Of course, I see the patients less because of that, because they have better gum.
But as long as they're working. You know, that's the important thing, you know, the gum disease that we all kind of have in some way or form and grow up with that.
And you know that the gum disease is leading to a lot of other disease and, you know, general health. Yeah. Like heart disease, you know, arthritis. There's a lot of studies that showing that a lot of diseases are related to the gum disease and the bacteria in the mouth, that they need to be under control. Right,
so that's why it's important to come and see you. Yeah. Now, you mentioned, just because you talked about it, sinus. You do sinus as well?
We do sinus lift.
Okay, what's a sinus lift?
Sinus lift is when you have, let's say you have a bad tooth that needs to be extracted in the back, and it has been a long time, you have a lot of bone loss there, and so you don't have enough space for placing an implant, which is the shortest implant that you can do back there, so you don't have a space. Then you have to add some grafting there and, you know, increase the thickness for placing an implant. So what we do, we open a window on the side, inside, and we just push some grafting in there and increase the height of the bone back there so that the implants can go in the same time actually in. And it's really working, and it's wonderful. And it's, we call it sinus lift, and in that procedure specifically or especially we use the PRP because when you use the platelet-rich plasma right inside, mixing with the grafting down there, so that you have a better result. So people, they just come back with no swelling, no redness, no sign of post-op, you know, infection. Yeah.
Now, just general people coming in just for general cleanings and that sort of thing. Still recommend every 6 months.
Every 6 months, yeah. That's the, you know, by book, every 6 months, and then we measure the pockets. If they have their periodontal disease, then they have to come more often, and if the periodontal disease is a little bit more advanced and the pockets are more than 6 millimeters, then we recommend deep cleaning first, conservative deep cleaning, and then if it's more than this and we see a lot of, you know, inflammation, or if it needs to have some periodontal surgery, we can do laser therapy too. I'm equipped with laser also.
Okay. Yes. So just depending what someone needs.
Yeah. And you remember, periodontal disease is not a curable disease. It's just maintainable. That's all. So once you have periodontal disease, you can just go higher in stages. You can never come back that much. You can maintain it right there. So we better maintain it. It's from stage 1 to 4, wherever we are, we better maintain it where we are.
Okay. Now, for folks who would like to come over and see you, can they call your office and then from there kind of talk about what type of insurance they have, must have?
Absolutely.
Or not must have, but what they have and how it'll fit with you folks.
Absolutely. I have a very friendly front office. Christina has been with me for years right now. She is my insurance coordinator, my manager, and she's very familiar with all the type of insurances that people in Laguna Woods might have. And call her and make an appointment. I have an associate doctor who is working for me 2 days a week, and we are a good team with 3 professional assistants in the back, and large office with massage and spa chairs, and very good, very good. You will like it. Just please come and just enjoy that and see the difference.
Okay. Now,
and have a brilliant smile.
And have a brilliant smile. And for more information, you can go online. And if you're going to do a search, put Brilliant Smile Laguna Hills, because that way that'll come up. And as we said, you're over by Coco's and Snooty Fox in that area.
Next to the lighting gallery, yes.
Yeah, and very close by. And they can give you a call and set something up. And it's great to see you.
Yeah, thank you.
You take care.
Thank you for having me.
And we'll be right back.